So I want to spend a bit of time talking to you about polycystic ovary syndrome because you will come across many women with this condition, and in some places there are clinics that are purely dealing with people who have polycystic ovary syndrome. So the aim and learning outcomes of these two screencasts is to provide an overview of PCOS and its management so that you may be able to describe what it is and critically review some possible causes, and then critically discuss the management of PCOS through diet and exercise, lifestyle change, and medication. So let's first have a look at the prevalence of PCOS. It is one of the most important endocrine disorders that affect women, and there have been a variety of criteria which are used to describe what PCOS is, and that leads to a very wide range of understanding of the prevalence of PCOS. So from 2.2 to 26% of the female population. Generally agreed it's about 1 in 10 women in the UK. And more women have polycystic ovaries, and I'll explain what that actually means in a little while, than actually have the syndrome. So you can have polycystic ovaries and not have polycystic ovarian syndrome. It is different with different ethnic minority groups, very low in Chinese women and lower in Caucasians than it is Middle Eastern and Black and minority ethnic groups. Highest prevalence in Aboriginal women and South Asian women, particularly those who migrate to developed countries, and that presumably is linked to the lifestyle changes and some genetic predisposition. So what are we actually talking about with PCOS? Well, it's a heterogeneous endocrine disorder that emerges from puberty. And what we mean by heterogeneous is that there are a number of endocrine components involved. It's not just one hormone imbalance, it's a number of different hormones that are involved. It is the leading cause of infertility in this country, and there is often a family history. The range of symptoms can be very mild, so they don't have a huge impact on quality of life, but they can be extremely severe with very significant impact on quality of life and life expectancy. And those who have milder symptoms, they of course tend to more likely to get picked up later in life, perhaps when they're trying to get pregnant and unable to do so. But more severe people with more severe symptoms will get picked up earlier. So it does range. It doesn't always get picked up in teenagers. So what are the symptoms? Firstly, irregular or absent periods because eggs are not released regularly. Excessive hair, which is referred to as hirsutism, on the face, chest, back, or buttocks. And have a think what that might feel like for a woman in that position. The hair on the scalp, unfortunately, then becomes very thin. So people will often have very thin hair so that you can see the scalp quite often, but hair in all the wrong places. People will be much more prone to acne or oily skin, and there will most likely be fertility issues, difficulty getting pregnant. Alongside that, and one of the main reasons that we will get involved in supporting women with PCOS is that there is often great difficulty controlling body weight. So it is one contributing factor to obesity. And the other aspect, of course, is the polycystic ovaries, which we've mentioned. Sorry, problems with my mouse. Oh, come on. So here are some of the things that might make people think, what's going on? Is there something wrong here? A whole different range of things that might lead to insulin resistance. We have the hormone imbalances as well, which is one of the main thing leading to polycystic ovary syndrome itself. And then we have hormone imbalances leading to dominance of estrogen, may affect thyroid function, more fat storage, more obesity. So there's a whole range of things going on with different links to cause different symptoms for people. But things to look out for if someone is wondering what is going on and why they're having various problems. So what are the complications of PCOS? Well, one of the reasons it's discussed in this particular session, in relation to this session, is because it's very closely linked with type 2 diabetes, and type 2 diabetes is a complication of PCOS. Not surprisingly, that also means there's an increased risk of cardiovascular disease, infertility, I have already mentioned, but also potentially pregnancy complications such as preeclampsia, which is a mixture of hypertension, protein in the urine, which can lead to profound fluid retention, swelling of feet and ankles, face and hands, headaches. This can be very dangerous. It's not as dangerous as it used to be. People may well get visual disturbances and pain in various parts, including below the rib cage. It can be a very serious complication if it's not picked up. For women who are having or accessing all of the antenatal care that is normally provided, they are likely to be picked up and managed, so that it may be that they have to have the baby earlier. But it's a very serious condition if it's not managed. Gestational diabetes is another likely complication. Endometrial cancer is just an increased risk of that. And alongside all the psychological aspects, there is anxiety and depression. And for those with obesity as well, they may well also have obstructive sleep apnea, whereas they stop breathing during sleep. So how do we diagnose PCOS? So it's most likely that someone will turn up to their GP with a range of symptoms, and the GP will then check hormone levels. Scans can be done to look at this classic picture of polycystic ovaries, unless the diagnosis is crystal clear without it. So if you've got all the classic symptoms and raised hormone levels, you don't really need an ultrasound scan as well. These are what we call cysts. We always refer to them as cysts, are actually fluid-filled follicles, 12 or more, in at least one ovary. That would be diagnostic of polycystic ovaries. And we don't normally give ultrasound scans to adolescents. So other causes of different symptoms need to be ruled out, but once that is done, the diagnosis of polycystic ovaries would be given. The things that are going to impact that are what stage of life someone has been diagnosed. Their ethnicity and family history will affect their risk of developing PCOS. We have all of the things we need to consider for cardiovascular disease. If someone does get pregnant, that looking out for gestational diabetes, pre-diabetes, type 2 diabetes. Quality of life is profoundly affected in some women, and therefore mental health, emotional well-being too. Body image, particularly with the excess hair, but also with the obesity. And you'll often get eating disorders and disordered eating because of those symptoms and people's attempts to try and control those. And we need to be mindful that for a lot of those symptoms, it's very counterculture. So our images of femininity will impact how people feel, because they may feel they feel more masculine, and that can be a major concern for people. More recently, of course, oh dear, sorry, this is really annoying this morning. We had to consider COVID, as for seem to be considering that for everything. But when you think of all the list of things that we've looked at so far, you can see that somebody with PCOS has a lot of risk factors that might increase their risk if they get COVID-19. So there's a lot of overlap there. So typically, a woman with PCOS would be seen as would mostly be quite young, and therefore not necessarily been picked up as increased risk. But many of those characteristics generally increase the risk of severe COVID-19. So there's a strong overlap, as you can see from this slide. So let's have a think about what the causes of PCOS are. Well, we don't really know. It's likely a combination, so multifactorial, looking at genetic predisposition and environmental factors as well. Obesity is most definitely linked. I'll just talk a little bit about which comes first, and we're not quite sure. But it doesn't seem to be a dominant link, so we don't always have it running in families, but sometimes do. So it's perhaps a recessive gene that's leading to that. And the hormone imbalance is extremely common. But again, which comes first is very confusing picture. So we've got these interactions going on. Insulin resistance, PCOS, obesity, which way round? We know insulin resistance contributes to obesity. We know it's an underlying cause of PCOS, but obesity also causes insulin resistance. So which comes first? We simply don't know. There's still a lot of work going on to trying to understand it. What we do know is that we need to manage each of those aspects as well as possible to decrease all the symptoms. So we get a little bit of a vicious cycle going on. And it's a very difficult situation for women with severe PCOS. We have this increase in insulin, we have uncontrolled eating, comfort eating, leading to increased insulin. People feel a little bit out of control. Their symptoms, if they are overeating, will get worse. So if people gain weight, their PCOS symptoms are likely to get worse, which is why one of the major treatments will be weight loss. You're going to get more insulin then, and you will get that. Contrary, we're trying to restrict diet to try and control weight. People may get into the habit of skipping meals. We end up with the low mental health, which of course often encourages people to eat in an uncontrolled way. So it can feel very, very out of control for women with PCOS, and they need a lot of support, often need a lot of support in order to help them to try and get some control over their symptoms.